Mass disaster investigation cannot be bypassed in medico-legal practice. What are the learning outcomes? You should be able to define the term mass disaster, objectives of the mass disaster investigation, steps to be followed, what do you mean by DVI, and legal and ethical background as a summary. What is a mass disaster? It refers to a situation of multiple deaths occurring from a single incident. So this is the important thing, single incident, and the capacity to handle by usual death investigation by the local authorities should be exceeded. So these are the keywords that you have to understand. And what's the number of deaths that should be constituted as a mass disaster? It is doubtful, but usually it is believed that more than 10 deaths can be considered as a mass disaster. Occasions where we can see mass disasters, it could be natural, it could be accidents, it could be industrial, gas leaks, explosions, and also as man-made mass disasters as well. Another way of typing of mass disasters, there are two ways. It could be closed or open. What do you mean by closed mass disaster? That means the number of individuals involved are actually documented somewhere, as in as an example of airplane crash, the list of names or list of the name list of passengers can be available. However, when it comes to open mass disasters, that means the number and identity of victims involved is mainly unknown. Example, World Trade Center tragedy, tsunami. You can understand now the meaning of closed and open as well. What are the common features seen in mass disasters? A large number of deaths actually cannot easily be handled. Usually common cause of death and manner of death, but may be exceptions as well. Common cause of death and manner of death. An extensive damage, both life and property. Panic and anxiety among the individuals. Disruption of communication. And also disaster management should be pre-planned as a special feature. There are certain other special features that we have to follow. There should be trained personnel in each discipline, as this is a team effort. It's a multidisciplinary task, and the plan should be clear and simple to follow. It should be adaptable in day and day out, and also the team should be very friendly, and there should be leaders as well. Finally, study about the lesson learned and how to minimize the disaster is also a feature. What are the objectives of a mass disaster investigation? The first and foremost one is victim identification, because as you can understand, there are multiple deaths, and also determination of cause and manner of death, collection of forensic evidence, preservation of human dignity, and also family assistance, support for legal and humanitarian efforts, public health and safety assessment, and disaster preparedness and response improvement in future mass disasters, and finally documentation and maintaining the chain of custody. Now you can understand this kind of situation demands the first of all rescuing of live people and then transportation of survivors for a suitable place or a hospital. So we usually term it as the rescue phase. Then only dead bodies should be transported or should be handled. Actually speaking, all the dead bodies ideally can manage in a single mortuary, and identification of cause of death and giving evidence in legal proceedings if required is a must. Right. Now, when we think about the mass disaster situation and identification and other medico-legal issues, there may be dead bodies which can be easily identified by the relatives. So, no problem as such. However, there is another category where dead bodies may be destroyed, mutilated, charred, and also there may be unknown dead bodies. All right, so now you can understand with the normal dead bodies, it's okay because relatives will come and identify the person. But the problem will arise with unknown, unidentified, mutilated, and charred dead bodies. As a result, in such situations, the identification and the medico-legal investigation is really, really difficult. Now you can understand the meaning of disaster victim identification and DVI. We are going to simply discuss it later. As you can understand, we have to have preparedness and also rehearsals, how to face it, and temporary lodging as well. Right. According to the guidelines, the following steps should be followed. First of all, we have to have, as I have mentioned earlier, the super keen eye to differentiate live people from the dead. And also we have to transport them into the nearest hospital within the rescue place. Then only we are going to think about recovery of dead bodies and other parts in the scene. And initial management of body parts brought to the body holding area or temporary mortuary, and then identification of the dead body, postmortem examination and release of dead bodies or parts, and handing over the personal effects, and finally counseling. So these are the basic steps that you have to follow in a case of mass disaster. Right, so now we are going to discuss very simply one by one. Recovery of bodies or body parts at the scene. The first thing is security clearance, because still there may be certain risks for the team as well. And also visit the team, and also the team should be there as soon as possible, and also they have to be very well coordinated among each other. Now there may be a lot of people: forensic pathologist, police, scientist, odontologist, photographer, lab staff, mortuary staff, or anybody else that is required into that specific mass disaster. Example, in plane crashes, aviation engineers, ballistic experts. You can understand the team. And then you have to visit without any delay with all the instruments. If warrants long stay, you have to have the preparedness for that as well. And also identify survivors and dispatch them to hospital, as I have described earlier. And then describe, sketch and photograph the scene. And also the important thing that you have to understand, we can't haphazardly bundling up dead bodies or body parts. All right, before touching anything or have any disturbance to any dead body or any item or anything, you have to describe, sketch and photograph everything very nicely. There are multiple methods to be followed for searching dead bodies. Just to tell about now, otherwise we are going to miss certain things and places. So as a result, there are certain methods. Spiral search method, that means in a case of mountain-like area, right? So you can start like this and come down, or else the grid method. You can start like this, all right? So as grids, you can start like this and you can complete the situation. And strip or line methods or search, and quadrant or zone searching. Now you are not going to go into much detail, but just to have the idea, we have to search dead bodies in a particular way. Right. Each dead body or body part have to indicate on the sketch, and also you have to take measurements, sketches, and then videoing or photographing should be done before removing any body part. The idea is, after moving the dead body, after a while also you should be able to see and reconstruct everything as it is of the initial crime scene. So this is the idea of that. Each body or body part is carefully placed in a body bag, and this bag is also given the same number as the body that we have given during the crime scene investigation. And also loose items such as jewelry should not go to the same bag, as it could lead to the wrong identification. Now you can understand. All right. So now we have moved quickly with the team, security clearance, and also liaison with the leaders, and we have dispatched the live people. Now we are allowed to handle the dead bodies. All right. Now then we have sketched, photographs, videoing, and everything performed, and then you are going to give ideal or serial numbers to dead bodies and body parts as well. Now we are there, right? So now if you can find something, an umbrella nearby your body, you are not going to give it the same number as the dead body, thinking that this umbrella belong to this person. No, you are not going to do this. You have to have separate numbering system so as to investigate it properly, the person who belonged it. All right. And also if you found any body part, again especially you have to understand, you can't guess things. You have to definitely give a separate number for different body parts as well. You can't assume or you can't guess anything. Imagine if a limb is merely attached with the skin tag, yes, you can give the same number. If not so, if they are how close to each other, body parts and a body, you are not going to give the same number. All right. So now you have tagged with waterproof methods, right? So now you have done everything now. Now the next duty is to transportation of the dead bodies, ideally to a single mortuary, because it's very easy to identify people in a single mortuary by the public. So these are usually temporary places such as school or a storehouse, right? And then as the second part, initial management of dead bodies or parts that brought to the area, and then you are going to have the temporary mortuary as I have described earlier. There you have an entry register. So while the dead bodies are receiving, there should be another workers to have nice entries. With the number given at the scene, you have to enter the dead body there with the arrival time and number of bags and etc. etc. And then you are going to open one file to each and every dead body or a body part or unidentified ornaments. All right. And later you have to at least take 3 to 4 photographs to cover head, face, full body or ornaments. One should go to the file files. Now you have to have now these photographs you have to display now for the public to get identified by their relatives. As it is mentioned like this, right? So you have to take a whole face, whole body, upper body and lower body, and such as at least you have to take 3 to 4 photographs to be displayed and also to keep evidence as well, right? And then finally you can display such photographs in order to identify by the relatives. However, now there is another thing to be mentioned. Imagine now you can see jewelry or wallets or anything along with the dead body. So you are not going to display the dead body. Now there are 2 ways that you can display, all right? You can display the dead body or you can display the images as well. However, whatever it is, you are not going to display with jewelry and other valuable items because of obvious reasons. Now you are going to mark everything, give numbers, and then you are going to store valuable items in another bag, and also that bag should get the same serial number. Finally, along with the proper identification, you can release these items with care. Make a note on probable age, sex and complexion. Right, so now meantime the police people will take fingerprints, right, and then now it's time to identification of the dead body, right. So you are going, as I have mentioned you earlier, there are two ways. Either you can display all the dead bodies in good light, or you can display the images. Now with that, right, so there may be fresh dead bodies unharmed, so relatives will come and identify the dead body. For the dismemberment part, we have to take care now. We are not going to do the post-mortem examination for unidentified dead bodies or body parts until they are identified clearly. Once the positively identified bodies move to the post-mortem room for post-mortem examination, and then we are going to do the full post-mortem examination. Full post-mortem examination, not halfway business. What we are going to do for the bodies that not identified yet, right? So now this is the point where we have to have another steps called disaster victim identification protocol. Right, now you can understand a set of bodies, just we can do the post-mortem and release for the relatives with care, but there should be another set of dead bodies where still the identification is impossible. So in this case, we have to keep the dead bodies. Either we can have refrigerated containers, temporary burial, as you can understand, right? So now if we can't do anything, it is considered as a safer method to bury dead bodies temporarily. It is considered as a natural refrigeration method. And we can put dry ice, and also we can have chemical methods such as embalming rarely as well. The idea is we can't release dead bodies, or we can't perform the post-mortem examination without positive identification of the person. Right. Post-mortem examination. We do a complete post-mortem examination. Even for parts of the bodies, we have to do the complete one. And also we have to collect DNA, fingerprints and everything. And we have to take photographs of tattoos and everything, scars, as you can identify, because these facts are very important for the identification. Right. By doing the post-mortem, we are going to determine the cause of death, collection of trace materials, and also relative positions and everything. And also sometimes these health conditions are very much important in case of compensation matters as well. Right. So with the post-mortem and everything has been performed and evidence had been collected, now it's time to release of the dead bodies without any delay. Right. So now it's our responsibility to hand over the dead bodies with respect. Now, as I have explained you earlier, unidentified bodies or unclaimed dead bodies, now we have to keep for a while until they are identified. Right, so counseling, I'm not going to discuss much, right? So obviously we have to have such kind of facility for the relatives as well. Right. Now we are moving on to the management of unidentifiable bodies in mass disaster. For that, we have it had been developed a protocol called disaster victim identification. It is a systematic process of identifying victims in a mass disaster using scientific and legally accepted methods, based on guidelines prepared by Interpol. Right, the International Policing Organization or Interpol has developed a protocol for the identification of victims of mass disaster, which emphasizes the need for a coordinated multidisciplinary approach to management and this procedure divides into series of 5 phases, right? So now disaster victim identification has got 5 phases, right? So these are the phases. Phase 1, scene examination and body recovery. Phase 2, mortuary. Phase 3, that means for identified people and the receiving of dead bodies and that part. And then phase 3, now we are dealing with unidentified mainly. So we have to definitely collect antemortem records from the relatives or from the interested parties to be compared with post-mortem findings. Otherwise, DVI also can't help us to identify people. Phase 4, reconciliation, and phase 5, debriefing. So these are the phases of DVI. Right. So now you can understand, as I have mentioned you earlier, to identify positively the unknown dead bodies, there should be certain antemortem data. For that, they have got yellow papers or yellow forms, right? So we publish that there are certain number of dead bodies. Please bring your items, maybe hair samples, maybe dental data by the relatives, and we are going to collect everything. Now we are going to compare these findings with the post-mortem data. All right. Now if we can get a match with primary or secondary identification methods that I am going to detail later, now we are going to either to confirm or to reject the identification. Right. So now collection of antemortem data is an important step during DVI process. Right. Finally, comparison will occur as I have explained you earlier. What do you mean by primary identifiers? Dental data, fingerprints, DNA, and medical radiological data, right? So X-ray findings. So these are considered as primary identifiers because they are somewhat reliable. DNA and everything, yes, it's highly reliable. What do you mean by secondary identifiers? So that means if a dead body is in a fresh condition, we can still use personal belongings and other wallets, ID cards, and descriptions from the relatives to identify the unknown people. Right. So legal and ethical considerations. Mass disaster investigation depends on the law of the country. However, I am not going to discuss detail. However, we have to have legal and ethical obligations in each and every scenario. Right. So now we are moving on to the last part, practice MCQs, which are simple, true and false. Right. A primary aim of disaster victim identification is rapid burial of dead bodies even without identification to prevent environmental order. What do you think? Can we bury or finish the disaster victim identification? Really? Never. All right. So it's immaterial about the time period. Our main purpose is positive identification. So the primary aim is not that. All right. So in this case, it's incorrect. So we want to positively identify people, number, cause, and everything. All right. Right. Standardized protocols such as Interpol DVI guidelines are used in mass disaster management. Yes. So this is the guideline that we are going to use. Visual identification alone is reliable in certain conditions? Yes, definitely. Triage in mass disasters includes prioritizing both living victims and deceased bodies. Yes, definitely. Right. So triaging means that. Personal belongings found with a body are sufficient for definitive identification in all cases. Not so. All right. Not in all cases. Yes, as secondary methods. Right. So secondary identification methods. Yes, sometimes it's okay. Not in all methods. Forensic odontological comparison is useful in identifying victims in aviation disaster. Yes, now as you can understand, teeth are highly resistant for temperature. As a result, odontological comparison is a must in case of aviation accidents. So this is true. The medico-legal investigator has no role in disaster scene management. Definitely false. Antemortem data collection is an optional step in victim identification. No. Without any antemortem data, we can't identify many people. because we have to use DNA, fingerprints, all right. So antemortem medical reports, right. So this is false. Mass disasters do not require coordination between multiple agencies. Yes, this is a team effort. So as a result, this is really incorrect. Secondary disaster hazards such as chemical fire, structural collapse must be considered during recovery. Definitely, right. Proper documentation of body recovery sites is not necessary if bodies are labeled. No, it's incorrect. That's why I have mentioned that you have to have sketch properly, and also you have to have proper numbering and also imaging, all right. Then only you can remove the dead body. So this is a must. Proper documentation of body recovery sites is not necessary if bodies are labeled. You have to document everything, and at the same time you have to label everything. The idea is after a while you can reconstruct everything by having a look of the images and your sketches and videoing and everything. Then the body number 5 was very near to the blast. So likewise you can reconstruct. You can identify the suicidal bomber or anybody, right. Closed mass disaster are easier to be handled. Yes, that's true. That means we get usually a list of names of the people who had faced the situation of mass disaster. Performing of autopsy examination is optional. No, it's incorrect. There may be very rare exceptions, but usually in each and every dead body should be autopsied, and also if it's even a body part, still a full postmortem examination should be there. Individual body parts are not treated as separate postmortem examinations. It is incorrect. Right. With that, I am going to stop the lecture. Thank you.